One of my patent pending, let's say, uses for exosomes is I use them to go spray up the nose. I use an atomizer, so it's like if you were using Afrin or neosynephrine, you spray up the nose exosomes and you can regenerate the olfactory nerves, which are connected to the olfactory bulb under the brain. What is that responsible for? That's responsible for our sense of smell and taste. What do people lose during COVID? Sense of smell and taste. So I patent pending on a way to use exosomes and use that with something called an atomizer. Guys, look it up if you don't know what it is, but you attach it to a syringe with a lure lock, and when you push the rod of the syringe, you get such a fine spray you can hardly see it. You coat the sinus cavity, you coat the olfactory nerves, which gets the olfactory bulb. Within 3 weeks, most of my clients, depending upon how long they've lost their sense of smell and taste, will get their sense of smell and taste back. It is remarkable. That's how good exosomes work. Now, what else can you do with exosomes? Now, this is great. We can use them intravenously for people with long haul COVID. I have used them for people with monkeypox, believe it or not, in New York City. I have also used them for people with Lyme's disease. I've used them for people with autoimmune disorders, including chronic autoimmune disorders like lupus and rheumatoid arthritis. Also, ready? I've used them for heart disease, lung disease, liver disease, pancreas problems that are leading to diabetes. All of these things and systemic disorders, exosomes can be used for. So, one other thing I want to mention is when I have someone with a really bad knee, what I'll do is I will use some of the exosomes intravenously, and then I will also inject the knee with exosomes. So I am getting a systemic way of healing the knee, systemically, and a localized way of healing the knee. So I go systemic and locally, and that's another way I get great results for bad knees. And you can do that with shoulders too. So I hope we clarified that, but let me again say, you can only do that once you know the laws of your state and your country, and you have to use only one specific brand of exosome to realize you'll be covered under their umbrella, under investigative new drug studies in coordination with the FDA in this country, the United States. Thank you very much.
Rejuvian Health, healing the future.